Hello everyone, welcome back to my YouTube channel. This is One-on-One Health Talk with Juliet. Today we'll be talking about malaria. We'll start with what is malaria. Malaria is a disease of the blood that is caused by Plasmodium parasite, and it's transferred from person to person through a particular type of mosquito. We have two types of malaria. We have the severe one and we have the uncomplicated one. During the case of the uncomplicated one, this is diagnosed when the symptoms is there, but there is no sign of serious infection. And the symptoms that comes with the uncomplicated malaria can last from 6 to 10 hours in the body, and it stops and reoccur every second day. That means in an environment whereby people are not used to malaria, trust me, it can be misdiagnosed. And you have the symptoms that doesn't last much, that is the 6 to 10 hours, and even after the diagnosing you can't see a serious infection on it. You might just think, okay, it's a normal thing, and if you leave it untreated, then it can lead to severe malaria. Symptoms of the uncomplicated malaria comes most time with a sensation of cold, shivering, vomiting, and feeling tired, and which comes to normal after some hours. And in an environment whereby people are already used to malaria, they already know what malaria is, they may start practicing self-medication. Immediately they see the symptoms, they start treating themselves of malaria, which I will hereby tell you that self-medication is not good. Anytime you have a symptom or you feel something funny in any part of your body, it is good to immediately see your doctor about it. Then we'll go to the complicated malaria. This is diagnosed when you see when the symptoms are up, and immediately you see you see that the infection is present and it's serious. So symptoms that come with the severe malaria are fever and chills, impaired consciousness, deep breathing, and convulsion in some kids. You have problem maybe in respiratory organs and abnormal bleeding. Now we'll go to cause of malaria. Malaria happens when a female Anopheles mosquito bites and infects the body with Plasmodium. Only the female Anopheles mosquito can infect the body with malaria, with the parasite. Now we'll talk about diagnosis. Early diagnosis is critical for patients' recovery, and anyone showing signs of malaria should immediately be tested. Then the World Health Organization strongly advises that malaria should be tested, or the test should be carried out in the laboratory through the laboratory microscopic equipment to find out the parasite, to be able to, because that is more effective for detecting the parasites. Now we'll go to treatment. Treatment is aimed to eliminate the parasite from the host's bloodstream, and it's advised anyone that hasn't gotten disease yet, it can still be treated, to reduce the disease from the surroundings. ATC is the recommended drugs to treat the uncomplicated malaria. Now we'll talk about vaccination. Anyway, there is no vaccination yet for malaria, but we can always, our advice is, immediately you see any sign of malaria, it is good to immediately seek medical attention. And at the same time, we should all know how to be able to handle and take care of ourselves for us not to get bitten by this infected mosquitoes. But I will list some advice for travelers and for all individuals that can help us put away malaria. Now we'll start with if you're a traveler, you'll be embarking on a journey first. I'll advise you find out about the region you're traveling to, where you're going. Find out if it's a malaria endemic environment. If it is, First, you seek your advice from your doctor. Get your pills with you so it keeps you away from the risk of getting counterfeit over there, because there are a lot of pills and drugs for malaria outside there. But going with yours will help you, and you stay away from stagnant waters, because most time these mosquitoes breed in stagnant waters. You have your treated mosquito nets, you have your repellents, you have your always have your surroundings fumigated. Wear clothes that best cover your body, that will protect you from mosquito bites. Then make sure you get an air conditioned room, which, because when your room is cold, sometimes help in eradicating some insects that can't breed or survive in a cold environment. That's a good and other good ways to protect yourself. For a year after returning home, the traveler may be susceptible of symptoms of malaria, so donating blood at this time is not possible. And if you visited an area with malaria and you've been infected with malaria and been treated, after the treatment, donating of blood might not be possible for next 3 years. So I hope you like this. I hope we all enjoyed this time. I hope we all found this advice valuable and useful. But if you have any question, please drop your comments at the comment box and it's all be attended to. And thank you for dropping by this time. I'll be seeing you again in my next video. Bye for now.